Mr Rees-Mogg, has the government got a grip on this?
What many wanted to know as ministers met to plot their next move against coronavirus.
Mr Shap, are we going to follow Ireland's lead and close schools?
What we're going to do is absolutely follow the medical and scientific advice.
Are you going to close schools?
Shutting schools like Ireland?
The answer was no. The government thinks more limited measures remain the best remedy in an escalating health crisis. Flanked by his scientific advisers, the Prime Minister warned of the gravity of the situation.
I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time.
From tomorrow, in this new delay phase, those with a temperature or a new and persistent cough must self-isolate for 7 days. Evidence suggests you'd be infection-free by then. Schools should cancel trips abroad, and the elderly and vulnerable shouldn't go on cruises. Measures specifically not being brought in yet are closing schools, banning events such as sporting fixtures, and asking older people to self-isolate. But with up to 10,000 people possibly now infected in Britain, why the hesitation in following what other countries have done?
There may be measures that we could take which were of a very draconian and immediate nature that really did suppress drastically the contact between human beings in this country, but might mean that the delay, the disease simply came back, surged back.
As far as infection control is concerned, crowded stadiums aren't seen as high risk.
On average, one person infects 2 or 3 others. You therefore have a very low probability of infecting a large number of people in a stadium, or a rather higher probability of infecting people very close to you.
But in Scotland, events are being cancelled, apparently to relieve pressure on the emergency services.
We will, from the start of next week, advise the cancellation of mass gatherings of over 500 people that have the potential to have an impact on our frontline emergency services.
Meanwhile, Labour says the government needs to explain itself better.
I want the government to offer greater clarity. The British public are hearing about what's happening in Ireland, what's happening in Norway, what's happening in France, and they're asking legitimate questions about why are we not doing the same. Now, I agree we should always be following the science, but to maintain public confidence in the government's approach, they've got to be fully transparent.
The former Health Secretary is also uneasy about the plan.
The countries that seem to have been successful acted early, particularly on social distancing. And I think one of the things that will concern people is that we're not acting sooner.
Thank you all very much. Thank you.
The Prime Minister's light touch approach may change, he says, but for now it's a gamble he thinks will pay off. Libby Vina, News at 10, Westminster.